So I'm about to demonstrate how to do trachea suctioning and trachea cleaning. So the first thing I will do is to check my physician order, which I have one, the Chi 92090SX tracheostomy suction with normal saline by 8 p.m. No allergies. So when I'm done verifying my physician orders, I will go ahead and gather my supplies, and then I have my tracheostomy suction catheter kit. Inside there I have my whistle tip suction, I have my cup, and also I have my sterile gloves, and then I also need my normal saline. So once I'm done with my gathering my supplies, now I'm going to my patient room. Knock knock knock. Yes, my name is Anthony. Can you verify your name and date of birth for me? I know you can't talk, but you can nod if your name and date of birth matches. Okay. So are you Wanda Chi, date of birth 92090SS? She knows. Okay. I confirm the handband. Everything matches. Do you have any allergies? If you don't have, nod if you have. She don't have any allergies. Okay, everything matches. So my name is Anthony. I am your nurse today. You have an order for tracheostomy suctioning and also cleaning, and I'll be performing that, and I will also make sure that I assess for airway obstruction, and I also make sure that I bring the bed to my appropriate height. I remove the side of the rail close to me. I make sure that the patient in a fowler position, and I also make sure that I perform my hand hygiene, and I also don clean gloves. So once that is done, I also obtain patient vital signs. Also obtain patient oximetry reading, and also before I start, I'll make sure that I hyperoxygenate the patient with the ambu bag through the tracheostomy 5 to 6 times in 30 seconds before I start my procedure. And I also make sure that once I open this and get my whistle suction kit, once I open it, because sterile procedure, I make sure that put on my sterile gloves. This is the dirty hand, which with the hand I will use to get the suctioning machine from the wall, and I also make sure I check it with my normal saline to make sure that the suctioning machine is working, and I also ensure that while I'm suctioning, I maintain sterility, and I also make sure that I suction 10 seconds at a time, and I suction intermittently. So while I dip in my suction catheter and I meet a resistance, and then I'll start suctioning intermittently, and while coming out in a rotary motion, I'll still start suctioning. Make sure I don't suction more than 10 seconds at a time to avoid causing my patient tissue damage. And I also make sure that when I suction, I clean my suction with the saline, and then I will see if there's a need to suction again, or if I've done the suction very well. I also ensure that my suctioning machine will be set on between 100 and 120 millimeter mercury to make sure that I don't hurt my patient. So once I'm done with that, also make sure that while suctioning that I done my appropriate PPE as needed. Okay, so once I'm done with my suctioning, I will load up my suction catheter in my hand gloves, pull it out, then cover it with my second hand glove, and then I will dispose it appropriately. So once I'm done with that, it's now time for the cleaning, which is the part that I will be performing. So for my cleaning, I need my normal saline, I need my tracheostomy care tray, and then so to start with my cleaning, the first thing I will don on my clean gloves, and then I will remove my with my clean gloves. I will remove my old dressing. I will examine it for color, odor, consistency, and amount. And once I'm done with that, I'll roll it up on my hand gloves, roll it up with the second hand glove, and I'll dispose it appropriately. So now I'm ready for my cleaning. So I'll go ahead, because it's a sterile process, I'll go ahead and open this, because I'm gonna need it. Go ahead and open my sterile care tray. I'm touching only the 1-inch border. I don't know if you can see me, but touching only the 1-inch border. Okay. Yeah. Touching only the 1-inch border. I don't know if you can see me. So once I'm done with that, I'll go ahead and get my sterile gloves. But the sterile gloves it comes with is too small for me, so I'll use these gloves. So I'll go ahead and get this, my sterile gloves. I have such a small surface to work with, so once I get my sterile gloves, so I go ahead and hold it. So once I've done my sterile gloves, I'll go ahead and get everything from my tray out. Once I'm done with that, I'll go ahead and pour in my normal saline in my tray, my normal saline. I'll go ahead and pour my normal saline in my tray. Once I'm done with pouring my normal saline in different compartments of the tray, I'll go ahead and pour in my second glove. So holding it from inside out. Okay, let's do it. So then I can set my gloves. Because both of them are. So now I got my 2 sterile hand gloves. So I'll go ahead and start cleaning. So for my cleaning, I will make sure that this is the hand that is going to touch the tracheostomy. So it's gonna be my dirty hand, and this is gonna be my clean hand. So with my dirty hand, I will remove my tracheostomy and I will drop it on the tray. Okay, then I'll pick it back up, and then with my sterile hand, I will get my brush. Okay, I will dip it in. Okay, I will clean the outer. Once I'm done cleaning, I will toss it away, and then I will dip it again in another compartment of the clean saline, normal saline. So then when I get it out, I'll clean it. And I can use my 4x4 glove. I'll clean it. Once I'm done cleaning it, then I'll go ahead and I'll replace it. So now I've replaced it, which completes my stereo procedure. So the next thing I should do is to clean the outer. So for cleaning the outer, I will get my Q-tip. I will dip it. I'll clean from inner to outer, inner to outer, inner to outer. I'll drop it. I'll get another clean Q-tip. I'll dip it on a clean saline, clean inner to outer, inner to outer. I'll drop it, and then I'll get my 4x4, soak it on saline. I'll clean it inner to outer, inner to outer. So once I'm done with cleaning, then it's time for me to replace my stereo dressing. So I'll go ahead and get my clean dressing. I'll replace my clean dressing. Once I replace my clean dressing, I will also go ahead and replace my necktie. I'll make sure that I put in the new necktie before I remove the old tie. And I also make sure I put my 2 fingers in between the tie and the patient neck to make sure that I'm not strangulating my patient. So that's how you perform tracheostomy, suctioning, and cleaning. Then I'll bring my bed down to the lowest position, bring the rails up, making sure that it's still on a high Fowler position, and also bring the collar close to the patient. I'll bring the table close to the patient, and then I'll go ahead and bring the bed to the lowest safety position, and I'll also tell my patient that I'll be back in 30 minutes to check on her, and then I will document my procedure. So that's how you do tracheostomy, suctioning, and cleaning. Thank you.